Okay. Hello, everyone. Greetings for the day. I'm Anurag Tiwari from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear a mask when in public places and wash your hands regularly. We all know there are few must in skincare. One of those is usage of sunscreen as daily skincare regimen. Today, we not only need protection from sun rays, but also from IR and visible lights. When we are indoor at our office or home, we are more exposed to visible and IR rays due to high time spent on screens. Most of our time is spent on mobile, TV, laptop, and other accessories, which emits harmful rays and can further trigger skin related problems. So we need broad spectrum sunscreen which suits and protects our skin from these harmful rays. So today we have Dr. Kinal Joshi live from Bhavnagar, Gujarat to enlighten us on the topic of complete spectrum protection for comprehensive skin care. Dr. Kinal Joshi is a young, vibrant, and highly skilled cosmetic dermatologist having 7+ years of experience, currently practicing at Orchid Laser Hair and Skin Clinic, Bhavnagar. Dr. Kinal Joshi holds expertise in skin, hair aesthetics, and wellness, ensuring successful outcome and well-being of patients. Being young, she rarely connects well with the problems faced by today's youngster. So let's listen Dr. Kinal Joshi. So let's listen Dr. Kinal Joshi about today's topic. Welcome to our show, ma'am.
Thank you so much, dear, for kind introduction. So we'll start with basics. I'll just brief you about the sunscreen. So what are the various types of sunscreen? So there are mainly two types of sunscreen. One is physical blocker and one is chemical blockers. Physical blockers, they work by reflecting or scattering the UV rays, and its ingredient not absorbed in skin. Whereas chemical sunscreen, they work by absorbing the UV rays. However, both physical and chemical sunscreen help in protection against UV rays, UV sunlights. Now, the sunscreen we are getting in the market has properties of both physical and chemical sunscreen. In some patients who are allergic to chemical sunscreen, or children who can only use physical sunscreens. Okay, frequently used ingredients in physical blockers are zinc oxide and titanium dioxide, whereas frequently used ingredients in chemical blockers are avobenzone, salicylates, oxybenzone, and PABA. So frequently patients have questioned, okay, which sunscreen formulation should I use? So people who have oily skin should use gel-based sunscreen. A normal to combination skin patient can use gel-based sunscreen, or even they can use lotion form also. Whereas people who have dry skin should use sunscreen which are in cream formulation. So, and another questions are, what are the factors to keep in mind when you purchase the sunscreen, or how do you assess the efficacy of the sunscreen? So sunscreen efficacy expressed by two main factors. One is PF factor, another is SPF factor. First, the PF factor star rating stands for protection from UVA rays. 2-star means medium protection against UVA rays. 3-star means high protection, and 4-star means higher protection. Second, the SPF. SPF means sun protection factor, which stands for protection from UVB rays. If you applying SPF 50, that provides protection 93% against the UVB rays. SPF 30 provides 97% protection against UVB rays. And whereas SPF 50 provides 98% protection against UVB rays. When you are out in the sun constantly, and if you have done any skin procedure, you need to apply at least SPF 50 sunscreen. And when you are indoor, you can apply 30 SPF sunscreen. So, now the next question come in mind, that how much quantity of sunscreen should you apply? So it is really important factor in determining the degree of protection. You must apply at least 2 to 2.5 teaspoon or fingertip unit for your face and neck, and apply evenly on your face and neck. You must apply 15 to 20 minutes prior to you go out in the sun, and you should repeat it at every 2 to 3 hour interval. Some people, that after application of sunscreen, that face become really oily and sticky. So how should we fix that? Well, after you apply sunscreen, just dab your face with compact powder or face powder, and it will mattify your face. Or the already matted sunscreen are also available in the market. In many person, there are questions that should you apply sunscreen when you are sitting in indoors also? So definitely yes. UVA rays penetrates all kind of glasses, and it goes deep into your skin, and it will do photo aging. So for that, you must apply sunscreen when you are indoor also. People with acne prone skin should use non-comedogenic sunscreen, and people who are swimmers or who perspire a lot, they should use water resistant sunscreen. Okay, so that's all about the basics of sunscreen. And any further question can ready to give answers.
Okay, thank you very much, ma'am, for your valuable information. And now our first question for the day. How much sunscreen is enough for me to get protection from harmful sun rays? That's the most common question people ask these days.
Yes, for your face and for neck, there should be a 2 to 2.5 teaspoon of sunscreen. Means if we count in on fingertip, there should be 1 to 2 to 2.5 fingertip unit is required to cover full face and neck area.
Okay, and our audience understands English and Hindi both. Now I will ask another question in Hindi language. Okay, how to select a good sunscreen? एक अच्छी सनस्क्रीन को कैसे सेलेक्ट करते हैं मैम? आजकल ज्यादातर हमारे जो टीनेजर्स हैं मार्केट जाते हैं तो वो सोचते हैं कि किस तरह सिलेक्शन करना है हमें सनस्क्रीन का.
ओके यस, आपको दो जो मेन फैक्टर आपको ध्यान में रखने हैं वो है एक पीए फैक्टर एंड एक एसपीएफ फैक्टर. पीए फैक्टर जो आपको प्रोटेक्ट करता है यूवीए रेज से, तो वो स्टार रेटिंग रहता है 2+, 3+, 4+. 2+ मीन्स थोड़ा मीडियम प्रोटेक्शन, 3+ मीन्स हाई प्रोटेक्शन, एंड 4+ मीन्स हायर प्रोटेक्शन. So at least 3+ star होना required है. And SPF sun protection factor वो at least minimum 30 होना required है, जो हमको 97% तक protection देता है from UVB rays.
मैम हायर एसपीएफ मींस हायर प्रोटेक्शन, कितना सच है इस बात में? इज इट ट्रू?
डेफिनेटली डियर, हायर एसपीएफ मींस हायर प्रोटेक्शन. मतलब जो एसपीएफ 30 है वो 97% तक प्रोटेक्शन देता है, एंड एसपीएफ 50 है वो 98% तक प्रोटेक्शन देता है. पर जब भी आप बाहर जाते हो, यू आर आउट इन सन और यू हैव डन ऑन सम प्रोसीजर्स ऑन योर फेस, तो हायर प्रोटेक्शन इज नीडेड. अदरवाइज इफ यू आर इंडोर, एसपीएफ 30 इज ऑल्सो इनफ.
Okay, ma'am. Our next question is, how to apply, how much to apply, and what should be the frequency of applying sunscreen?
ओके, सनस्क्रीन है वो कोई भी अच्छा सनस्क्रीन ले लो तो उसका इफेक्ट है 2 to 3 hours तक रहता है, उसके बाद उसका इफेक्ट नहीं होता है। तो सनस्क्रीन जब भी हमको बाहर जाना है तो उसके एटलीस्ट 15 to 20 minutes बिफोर लगाना है, ठीक है। 2 to 3 hour के बाद उसको रिपीट करना है। एंड इट वी शुड अप्लाई ऑन ऑल एक्सपोज्ड एरिया, जहाँ सारे एक्सपोज्ड एरिया पे अप्लाई करना है, लाइक फेस, नेक, हैंड्स, जो भी एक्सपोज्ड है सब एरिया कवर करना है।
ओके ओके। एंड मैम आईआर एंड विजिबल लाइट्स क्या होता है? हम टर्म ये सुन रहे हैं फर्स्ट टाइम।
हाँ, आईआर मीन्स इंफ्रारेड।
ओके, एंड विजिबल लाइट्स।
हाँ, यस, वन सेकेंड हटिए।
यस
ओके,
मैम।
IR, sometimes called infrared light, is electromagnetic radiation with wavelength longer than those of visible light, 840 to 940 nanometer. Though they are invisible, but we can feel as heat. The visible spectrum is the portion of the electromagnetic spectrum that is visible to human eyes, that is 380 to 750 nanometer.
Okay.
The main sources of harmful IR and visible lights are sunlight. Apart from that, mobile phones, laptops, desktop screens will also emit IR rays.
You already answered our next question. That what are the
Yes.
sources of harmful IR and visible lights? Okay. So, ma'am,
Yeah.
I'm asking another question. Does sunscreen help us to prevent from these rays, and which type of sunscreen is good for this?
Yes, sunscreen protect us from UV lights, a type of radiation emitted by the sun. UV light can damage skin cell, causing sunburns, aging, and skin cancers. Two types of UV light can damage the skin, mainly UVA and UVB, and invisible light, as I already told you, infrared rays.
मैम, जब हम इंडोर में होते हैं, घर के अंदर होते हैं, तब हमें सनस्क्रीन यूज करना चाहिए कि नहीं, और उसकी फ्रीक्वेंसी क्या होनी चाहिए?
डेफिनेटली हम जब इंडोर होते हैं तभी हमें सनस्क्रीन यूज करना चाहिए, बिकॉज जो यूवी रेज है वो विंडोज में से पेनेट्रेट होके घर पे आते और स्किन को डैमेज करते। तो हमें इंडोर है तभी सनस्क्रीन लगाना है, एंड एवरी 2 to 3 hours पे हमें उसको रिपीट करना है।
मैम, is sunscreen only required in summer season and not in other seasons? Is it true?
नो, वी शुड अप्लाई सनस्क्रीन इन ऑल सीजन, सारे सीजन्स में सनस्क्रीन लगाना है, बिकॉज इवन इन क्लाउडी एनवायरमेंट्स यूवी रेज कैन इजीली पेनिट्रेट द क्लाउड्स एंड कम टू योर स्किन। सो हमें सारे सीजन में सनस्क्रीन लगाना है।
हम दैट्स वाई देखा गया है कि जब क्लाउडी वेदर होता है तो स्किन थोड़ी सी टैन हो जाती है जल्दी।
यस यस, पीपल के माइंड में थोड़ा फॉल्स बिलीफ रहता है कि इट इज क्लाउडी, इट्स ओके इफ वी आर नॉट अप्लाइंग सनस्क्रीन, बट नो, वी शुड अप्लाई सनस्क्रीन इवन इन क्लाउडी एनवायरमेंट्स।
ओके मैम, applying sunscreen makes my skin oily and greasy. What to do, and do I need to change and select new sunscreen?
यस, सनस्क्रीन से थोड़ा कभी कभार पेशेंट्स को ऐसा फील होता है कि वो थोड़ा ऑयली हो गया है, थोड़ा स्टिकी हो गया है, बट एज आई टोल्ड यू कि आफ्टर सनस्क्रीन इफ पेशेंट फील के फेस ज्यादा ऑयली है, दे कैन जस्ट डैब फेस पाउडर और कॉम्पैक्ट पाउडर टू मेक इट मोर ड्राई, और matte sunscreens are also available, so they can use matte sunscreen also.
Ma'am, we have a question from our viewer. His name is Nitya Krishnan. What does broad spectrum sunscreen protect against? I'm repeating this question. What does broad spectrum sunscreen protect against?
Okay, broad spectrum sunscreen means it will protect you from UVA and UVB, both the rays.
Okay, so the next question is from Samir Sahane, and he's asking that can we use sunscreen in acne prone skin?
डेफिनेटली एक्ने प्रोन स्किन में भी आपको सनस्क्रीन यूज करना है, बिकॉज जब भी एक्ने हील होता है that it will leave marks, उसके बाद थोड़े स्पॉट्स रह जाते हैं. इफ यू आर अप्लाइंग सनस्क्रीन रेगुलरली तो स्पॉट होने के चांसेस कम है. इवन सन एक्सपोजर से भी एक्ने बढ़ता है, पिंपल्स बढ़ता है. सो इट विल प्रोटेक्ट यू फ्रॉम पिंपल ऑल्सो. सो एक्ने प्रोन स्किन के लिए भी एवरीवन शुड यूज सनस्क्रीन, बट इट शुड बी नॉन कॉमेडोजेनिक सनस्क्रीन. को नॉन कॉमेडोजेनिक सनस्क्रीन यूज करना है.
Okay, and our next viewer is asking, her name is Meenal Rajput, and she's asking, what does the SPF number signify?
Okay, SPF stands for sun protection factor. It is a marker for UVB protection, UVB rays protection. So if SPF 15 is there, so protection from UVB is around 93%. SPF 30 means UVB protection factor is 97%. And SPF 50, it means UVB protection is around 98%.
Okay, and MD Shahrukh is asking something, and he's asking that what precautions should one take when using sunscreen?
Okay, means you need to apply sunscreen 15 to 20 minutes before you go out. Then you should apply sunscreen not only on face, you should apply on face, neck, and all exposed area. And you should reapply at 2 to 3 hour interval.
Okay, Lovely Singh is asking, can I use sunscreen I bought last summer? That's kind of different question, I think.
Yes, you can apply, but you first need to check expiry date of that sunscreen.
Ashok Jhala is asking, ma'am, which is better, SPF or melasma? Which SPF better? He's writing.
For melasma, which SPF is better?
Yes,
melasma occurs because of sun exposure. Even melasma can aggravate after sun exposure, so they need higher protection from sun. So at least minimum requirement is 30 SPF, and at least 3 PA star rating 3+. Or if they are going outside more and more sun exposure is there, or field work is there, they need to apply 50 SPF for melasma and need to reapply it every 2 to 3 hour interval.
Okay. Ma'am, A. Raju is asking, should people of color be concerned about sun safety? Should people of
skin color,
dark skin color, whether people have dark complexion, might be saying.
Yes, each and every skin type need to apply sunscreen, because the fairer skin, the skin type 1, 2, and 3, that get easily burns after sun exposure, so they need to apply sunscreen. And the skin type of like 4, 5, and 6, like Asian skin, Indian skin, will get easily tanned by sun exposure. So they need to protect from sun exposure. They need to protect skin from sun exposure. So they need to apply sunscreen. Even darker skin need to apply sunscreen.
And the next question that is asking by Kanika Arya is asking, she's asking, what is the difference between UVA and UVB rays?
There are mainly three types of UV radiation, ultraviolet radiation, UVA, UVB, and UVC. The UVA and UVB is more harmful to skin. They will cause photoaging. They will cause skin cancer. So we need to protect the skin from both UVA and UVB rays.
Okay. Ma'am, Tripti Pandey is asking, how can I protect my skin from sun without sunscreen? That is the same question I also want to ask, but she asked first.
Okay, it's very difficult to protect face from without sunscreen, क्योंकि जब भी इवन जैसे मैंने बोला कि अगर आप इंडोर भी हो तो भी आपका मोबाइल है, गैजेट्स है, that emits radiation, तो आपको प्रोटेक्ट करना है. एंड यू कांट, मतलब आप कवर करके पूरे दिन घर पे नहीं रह सकते हो. यू नीड टू अप्लाई सनस्क्रीन. बाहर जाते हो, यू कैन कवर योर फेस विथ रुमाल और स्टॉल और दुपट्टा, एंड हैव योर हैट, हैव गॉगल्स. You can protect by this way, physical means.
Ma'am, Nitya Krishnan is asking what SPF level is recommended by health organizations.
There is no any particular recommendation, but as I earlier told, you need to apply at least 30 SPF.
And ma'am, most different kind of question in our chat. Shivam Saraswat is asking, ma'am, tanning कैसे हटाएं? मतलब बहुत concern है उन्हें. ये सभी लोगों को रहता है खैर tanning का तो. So he's asking about this.
Yes. For tanning, there are many different detanning creams, detanning procedures like chemical peeling and Q-switch lasers are available. But the first and foremost for treatment, sunscreen is must.
But is there any home remedy? He's asking that kind of thing. Is any home procedure or remedy that can be used for removal of tanning from our skin?
Like the mild fruit juices, they contain vitamin C, and they time to time exfoliate करता है skin को, तो gradually वो detanning करता है. तो one can use fruit juice, or one can use curd to mild exfoliation of the skin.
Ma'am, Hana Bakshi is asking, what does PA++ means?
Yes, PA++ means PA 2 star
Okay.
rating, means it suggests protection from UVA radiation, and PA2+ means medium protection from UVA radiation.
Okay. Ma'am, Vikas Paryar is asking, do men also need sunscreen and which SPF?
Yes, definitely. Men also require sunscreen, because sunlight will do same thing on male and female. दोनों को same ही effect आने वाला है. So they can easily get sunburn and tanning from sunlight. So sunscreen male को भी लगाना है, and male are going more outside. उनका बाहर जाना, sunlight में आना जाना, field work बहुत ज़्यादा रहता है. So they need to apply sunscreen higher SPF, like 50 around, and PA factor 3+ or 4+ around, and they need to reapply it every 2 to 3 hour interval.
And there is another interesting question. Sandesh Sangare is asking, ma'am, tell us about oral sunscreen. Is it really helpful on UV radiation protection? I have heard this first time, oral sunscreen. So please elaborate on this, ma'am.
Sure. There are many antioxidants available in market, like beta carotene. We sometimes called it oral sunscreen, because वो आपकी बॉडी को इंटरनली प्रोटेक्ट करता है. जो सनलाइट से जो फोटोसेंसिटिविटी है उसको डिक्रीज करता है, उसको कम करता है. तो जो एंटीऑक्सीडेंट टैबलेट रहता है, लाइक ग्लूटाथायोन, विटामिन सी, बीटा कैरोटीन, वो सारे इंग्रेडिएंट्स है, वो ओरल एंटी सनस्क्रीन माने जाते हैं.
Okay, ma'am. Ma'am, Megha Sahu is asking that same question which you have answered earlier, but I think she has just joined the chat. So can you please answer again for this? What does broad spectrum sunscreen protect against? She's asking.
Yes, I'll definitely explain again. Broad spectrum sunscreen means it protects us from UVA and UVB both rays.
Okay. Ma'am, A. Raju is asking how to apply and store sunscreen.
How to apply means the quantity, as I told you, 2 to 2.5 fingertip of unit for face and neck, and you should apply 15 to 20 minutes prior you go to sun. And the next was,
and how to store that sunscreen.
Okay, sunscreen should be stored in cool and dark place, as we are storing other medicines also in cool and dark place.
Okay, ma'am, another question is, what are the home remedies for sun protection? That question again with some different kind of wordings. Home
Okay.
remedies, she's asking.
Yes. Who means the another way, जो सनस्क्रीन के अलावा जो आपको यूज करना है, like from sun protection, so you can use your goggles, you can use stole और दुपट्टा वगैरह to prevent from sun. And फ्रॉम टैनिंग, अगर आपको टैनिंग प्रिवेंट करना है, मगर टैनिंग हो गया है उसको निकालना है विथ होम रेमेडीज, एज आई टोल्ड यू, जो भी साइट्रस फ्रूट्स है उसमें माइल्ड फ्रूट एक्सट्रैक्ट्स है, जो एंजाइम्स है वो स्किन को ग्रेजुअली एक्सफोलिएट करते हैं. सो यू कैन अप्लाई दैट फ्रूट जूस टू एक्सफोलिएट योर स्किन टू रिमूव टैनिंग.
ओके मैम, गिनी शर्मा पूछ रही हैं कि जो शहद होता है, हनी, क्या वो प्रोटेक्ट करता है स्किन को सन से?
नो
शहद.
नो नो नो, शहद नहीं प्रोटेक्ट करता है.
Okay, ma'am, that user Nitya Krishnan is asking, will a base 10 offer protection from further skin damage from the sun? Base 10.
I'm not getting you.
Okay, she's asking, will a base 10 offer protection from further skin damage from the sun?
Sorry.
Base 10. Base 10. Base 10. BASETAN.
Sorry, I'll just read the question.
Okay. Will हाँ मैम, base 10 she's asking about.
We'll give you answer later on.
Okay. Next question is from Bipin Patel. Does formulation of the sunscreen or the base used in sunscreen matters in terms of compliance?
Yes, definitely. People with oily skin need to apply gel-based sunscreen, and people with normal to combination skin can use gel-based or the lotion form also. And people with dry skin can use a cream-based sunscreen.
Okay. And there's also one question from my side, which I was thinking to ask you. I don't use sunscreen because when I use it gives me acne. So what to do about this? Many people have the same problem.
Definitely. The acne prone skin जो रहता है persons, उनको हमेशा gel based sunscreen use करना है और non comedogenic sunscreen use करना है. So उससे पिंपल बढ़ने का या acne आने का प्रॉब्लम नहीं रहता है.
Okay, thank you very much. And then the next question is, what is the best natural sunscreen for face? People want to try something natural.
Okay. As of now, जैसे कोई ऐसे नेचुरल जो भी एप्लीकेशन है वो आपको सन एक्सपोजर से प्रोटेक्ट नहीं कर पाएगा, बट द डाइट, जो अपना नेचुरल डाइट रहता है, जो हमने बोला ओरल सनस्क्रीन लाइक बीटा कैरोटीन, विटामिन सी, तो जो हम ये बीटा कैरोटीन और विटामिन सी जिसमें से मिलता है लाइक टोमेटोज, पपीता एंड द कैरेट, वो सब में बीटा कैरोटीन ज्यादा रहता है. अगर हमारा इंटेक वो ज्यादा है तो नेचुरली एंटीऑक्सीडेंट इंटेक ज्यादा है हमारा, तो नेचुरली हमको फोटो प्रोटेक्शन देता है, सन प्रोटेक्शन देता है. बट नो एनी होम रेमेडीज लाइक कुछ दही लगा लिया तो सन प्रोटेक्शन हो गया, या फिर कुछ हनी लगा लिया तो सन प्रोटेक्शन वैसे नहीं होगा, नॉट विथ एप्लीकेशन. बट अगर आपका डाइट में वो ओरल सनस्क्रीन वाला फैक्टर्स है वो ज्यादा है, बीटा कैरोटीन ज्यादा है, देन इट विल हेल्प us.
So basically, a good diet will help in removing tanning and protecting from sun, rather
Definitely,
than only any
definitely.
home remedy. Okay. Next
Yes,
question is, what oil protects skin from sun? कुछ different है मैम. कौन सा oil जो है वो स्किन को बचाता है सन से, सन टैन से?
Oil has no properties like वो आपको sun exposure से बचाए. So कोई भी oil आपको बचा नहीं सकता है with sun exposure.
Okay, ma'am, Kiran is asking which is the best sunscreen for oily face?
Oily face, the formulation should be gel based, and oily skin will patient get easily have acne also, so they should use non-comedogenic sunscreen.
That what I was asking earlier about that acne problem. Similar
Yes,
thing.
yes, yes, yes.
Okay, so
Similar
the
things.
oily skin people can have acne while using sunscreen, so they
Yes.
should use that. Okay, and ma'am, someone is asking that what sunscreen do not contain oxybenzone?
Physical sun, as earlier I told you, there are two types of sunscreen. One is physical and one is chemical. So physical sunscreen only contain zinc oxide and titanium dioxide, so it will not contain oxybenzone.
Mamta is asking what are the worst sunscreens?
No,
she wants to avoid those
means,
products.
Okay, you can avoid SPF below than 15. Okay, below SPF 15 से जो कम है वो आपको नहीं यूज करना है. Then जिसमें PA factors नहीं है, मतलब it is not protecting you from UVA rays, तो वो आपको यूज नहीं करना है.
Okay, ma'am, someone is asking that sunscreen कौन सी ज्यादा अच्छी होती है, फिजिकल सनस्क्रीन और केमिकल सनस्क्रीन?
जनरली जो मार्केट में अवेलेबल रहता है दे आर बोथ कॉम्बिनेशन, मतलब फिजिकल सनस्क्रीन भी है और केमिकल सनस्क्रीन भी है. बट इफ पीपल जो एलर्जिक रहते हैं केमिकल से, so they need to apply physical sunscreen only, no any chemical sunscreen. और जो allergic नहीं है, they can use both, combination of physical and chemical.
Okay, ma'am. Thank you, Dr. Kinal Joshi, ma'am, for your valuable time. It has been quite an informative session for our viewers. We look forward for many more such sessions in coming times. Thank you, viewers, for an excellent participation. And for more information on how to keep your skin healthy and look beautiful, do join our campaign, Beautiful Spotless Skin Campaign, on Facebook. We are also available on YouTube, Twitter, and Insta. Thank you and good day to all. Thank you very much, ma'am.
Thank you so much.